Hey everyone, welcome back to Radiology Made Easy. Today we're looking at a fascinating case, a frontal chest x-ray of a woman. Let's dive into it. Right off the bat, you can see there's a lot going on in this x-ray. The most noticeable thing is the diffuse lung disease on both sides, with a lot of interstitial shadowing throughout. But interestingly, the costophrenic angles are relatively spared, which can be a bit of a clue. Now, the lung volumes are preserved, which is a good sign. There's no pneumothorax here, and the heart size is normal, so that's one less thing to worry about. But what really catches my eye is the appearance of the Hilar. They're bulky and irregular, without any visible calcification. This kind of pattern really gets us thinking about something systemic, like sarcoidosis. Sarcoidosis, as you might know, is a bit of a tricky condition because it can affect so many different parts of the body. When it shows up in the lungs, we often see bilateral Hilar and right paratracheal lymphadenopathy. In this case, the findings are pretty classic for sarcoidosis, but of course we need to dig a bit deeper. To get a better handle on what's going on, I'd recommend a high-resolution CT scan of the chest, especially if this is the first time the patient is presenting with these symptoms. It'll give us a much clearer picture of the lungs and mediastinum, helping to confirm our suspicions. Key points to keep in mind. It can be tough to distinguish between lymph nodes and blood vessels on an X-ray. Lymph nodes usually have irregular, bumpy outlines, while arteries are smoother. Infections like TB usually cause unilateral hilar enlargement, while things like lymphoma or metastases can go either way, unilateral or bilateral. Hilar calcification can help narrow down the diagnosis, but not having it doesn't rule anything out. Sarcoidosis doesn't just stick to the lungs, it can affect multiple systems. We could see signs in the liver, spleen, or even bones. The nodal enlargement and interstitial lung patterns we see here are typical for thoracic sarcoidosis. Sometimes these patterns can coalesce into larger nodules, and in some cases they might even cavitate, leading to fibrosis. What's next? We definitely want to correlate these findings with the patient's clinical picture and possibly consider a biopsy to confirm the diagnosis. It's all about piecing together the full story. Thanks for joining me on Radiology Made Easy. Remember, radiology is all about interpreting the clues in the images to tell the patient's story. Stay curious, and I'll see you next time with more intriguing cases.